Hi there. My name is Catherine Coster. I'm the Communications Director for SWOP-USA, and I apologize for the delay in our webinar, Reducing Overdose Among Sex Workers. Today we're joined by board member Magali Lehrman, who's going to talk about a little bit about our Good Samaritan kit, as well as sort of issues regarding the intersection of sex work and drug use, specifically around overdose. Today is International Overdose Awareness Day, which is why we decided to present on this topic. And I'm going to go to you, Magali, okay?
Great, thank you, Catherine, and hello, everyone. Thank you for joining us for this SWOP-USA mini webinar on reducing overdose among sex workers. My name is Magali Lehrman, and I am a SWOP-USA board member and a all-around harm reductionist, and I will be leading this webinar, which is informed by SWOP-USA's Good Samaritan Expansion Toolkit. Today is International Overdose Awareness Day, and so we dedicate this webinar to our friends and clients who have died from overdose. My friends and clients who have died from overdose are listed here on the right-hand side. I hold them in my heart today, and their loss every day motivates me to prevent the loss of many others. So I want to start by giving a little bit of context and talking about why it is important to build out policies and engage in advocacy strategies that protect both drug users and sex workers. Earlier this summer, I ran a webinar through SWOP-USA entitled The Intersection of Sex Work and Drug Use, and it is hyperlinked right here if you would like to go to the video and audio and see that if you weren't able to make it. And in it, I really highlighted three things. The first is that some drug users sell sex in the various iterations of the sex trade, and some sex workers use a variety of different substances. And two, that the socio-political response to sex work and drug use is pretty much the same, is very similar, and operates by way of criminalization of the things that we do with our body, and takes a criminal justice approach to what is a public health issues or what are public health issues. And these have similarly harmful effects on communities of people of color and people experiencing poverty. And then three, our communities of sex workers and drug users, therefore, are really well positioned to work together to bring harm reduction approaches to the sex trade and to drug use, as well as to engage in different advocacy strategies. We have a chance now to build strong community connections, relationships with law enforcement, and holistic policies so that all marginalized and disenfranchised people are protected when the day comes that we achieve decriminalized sex work and/or drug use. In this modern police state, protections for some leave others vulnerable. And this is why it's important to really build out policies that provide broad protections, is because if we are to decriminalize one thing, people are going to be increasingly arrested for another. And this is something that we have started to see with overdose prevention policies, and in particular, Good Samaritan laws. Good Samaritan laws, overdose protection laws, what they do is they provide limited immunity to people who either experience or witness an overdose, so that when 911 is called, and often police come with the medical assistance, they will not be arrested or prosecuted for drugs that they have on them. Now, I say limited immunity because many states are going in right now to try to strengthen their Good Samaritan statute, if they have one, which many states do, because the exemptions to immunity include if a person has a warrant, if a person is on probation or parole, if a person has more than what is deemed personal use amount, or if the amount that they hold is seen to be a selling amount or drug trafficking amount, and then also if they're engaging in something else that is illegal. And in this case, if anyone is engaging or perceived to be engaging in the sex trade, they are going to be arrested and prosecuted for sex work related charges. And as I also explained in the webinar earlier or this summer, sex work charges or solicitation charges are increasingly being charged as trafficking or trafficking related charges, which carry hefty sentences. We being SWOP-USA, started to get reports that these type of arrests were happening in states that had Good Samaritan laws, and that people were calling 911 and doing the right thing and trying to help save a life in the case of an overdose of a friend or client, but were being arrested anyway. And so we wanted to share some of the instances that this has been happening. Our Toolkit has many other instances that this has happened, but I really wanted to highlight 3 for you today that have happened in the last couple of years. The first happened in 2013 in Massachusetts, where a person named Joshua and a person named Tara called 911 to report the overdose of Tara's client. And even though there was a Good Samaritan law in place, both were later arrested. Tara was charged with prostitution and conspiracy. Joshua was charged with pimping and deriving support from prostitution. And then even earlier this year in Indiana, a person named Ronald, who had an ongoing relationship with a sex worker, called 911 when the sex worker overdosed from heroin, trying to get her help, and was arrested for promoting prostitution, maintaining a common nuisance, and patronizing a prostitute after he sought help for the person he had been seeing. Last one is especially poignant because it really highlights why someone might not call for medical backup in the case of an overdose, because they are forced with having to make a decision between their own life and another person's life, because there are many things that happen if a person is arrested and incarcerated and given a record, and then there's also different ways that a person might think that they can bring someone back. And so in this case, a person named Adele was working with a 17-year-old in a hotel. And it's important to note that this person was not only facing drug use and solicitation related charges, but because of anti-trafficking statutes, anyone who is under the age of 18 who is involved in the sex trade is automatically a victim of trafficking, regardless of if there is a trafficker or a third party at all. And so I think that it is very justifiable that this person was afraid to call when the 17-year-old overdosed, and in fact waited 4 hours to call 911, and she did, and was subsequently arrested. And we don't know the outcome of this case yet, but it is very possible that she is being tried for trafficking charges, trafficking of a minor, which carries a 5-year mandatory minimum sentence. So this is clearly happening, and this is a lot of what we foresaw happening when certain things are provided immunity in a criminalized environment. And so we decided that we wanted to support our chapters and local movements in starting to build out policies that provide protections for people in the sex trade who use drugs, and also to really bring drug using and sex working communities together. And a lot of this toolkit really, a lot of the point was to provide tangible step-by-step information on how to expand a Good Samaritan law or pass a Good Samaritan law that includes a carve-out for solicitation charges, and more broadly seeks to either potentially pass blanket protections for someone who calls 911 in the case of an overdose. The rest of this webinar, at least the next 15 minutes, is going to walk through some different components of our toolkit. If you're anything like me, you see a toolkit and you're like, oh, this is amazing, I really can't wait to read this, and it's on your desktop, and every day you're like, oh, this is great, I'm gonna read this at like 3 o'clock, and then 100 things happen, and it's been months and you still haven't read it. And so that was a lot of why we decided to do this mini webinar, was to highlight just some really critical aspects of this toolkit, and to highlight how important it is to provide overdose protections for people in the sex trade. And then if this is something that you are interested in engaging in, please dive deeply into the Good Samaritan Expansion Toolkit, which is linked right here for people, because it has a lot of really specific information, including templates and like example language, etc. So the first thing to do when wanting to expand a Good Samaritan law in your state is to start to look for other people who are in support of Good Samaritan laws. Even if there is one in your state who was an advocate in terms of passing that, and then if there's not one yet who works with drug users and is in favor of drug policy reform, and even if there is one, you'll find that these are a lot of times the organizations, and connect with those folks. And if you're not sure of who those folks are, our toolkit gives some national hubs that you can reach out to that are likely going to know who to connect with in your area. And these organizations include the Drug Policy Alliance, ACLU, Harm Reduction Coalition, and then also local syringe service programs, which if you don't know where to find out about a local syringe service program, you can go through the North American Syringe Exchange Network, or also tap into local or state health departments who might be able to connect you. And then once you're connected with those people, don't stop there. Because in addition to these people, you want to reach out to all of the groups in the area that hold shared values and whose constituency also can be using drugs or trading sex, or both of those. And these include feminist organizations, GLBTQ organizations, HIV/AIDS awareness groups, human rights groups, and labor rights groups. The important thing to know is that this is an intersectional issue, and you can help each other's projects and form connections that will last in the future. To do this, share other groups' posts and events, and then show up to these events. Introduce yourself and be direct with your desire to partner. Then be ready to guide and offer support when these groups agree to help you. And once they do agree to help you, if a coalition does not already exist, you can provide leadership to ensure that a coalition can operate and move forward. And so this can include finding a space to meet, setting up regular meeting times, and delegating different tasks. In some cases, there might be a coalition that is already meeting to address the opioid epidemic, because it is at an all-time high. Estimates say that 78 people a day are dying right now because of overdose. And so there are a lot of local efforts underway to get involved in. And if there's a coalition that is amenable to including sex workers and working together, then you'll want to be a contributing member of that group. And then once your group is together and has organized, you really get to do a lot of the fun part, and you get to create. You can make documents and media that promote your cause and distribute these freely, and then encourage everyone to share materials, create flyers, create Instagram images, and post these everywhere. Create slogans, create stickers, whatever you need to get the message across, create it. You'll want to stay informed and stay on top of local politics, and in our media engagement section, we talk a little bit about how to do that. And you'll also want to be visible. Again, anything that has to do with the opioid epidemic and overdose, you can get out there and say that sex workers are overdosing too and are vulnerable to arrest, where drug users might not be right now, or many drug users still are, because there aren't strong enough protections. And then once the legislative season begins, if there's any bill that has to do with the opioid epidemic, you can also be visible in that way. Talk about some tips to be visible in terms of media engagement here in a second. And then most importantly, when you're dealing with death and you're dealing with stigma, it's to take care of yourself and promote self-care among coalition members. There's some really fun ways to do that, whatever really feels best to you and your group. And then in terms of media engagement, our toolkit provides some tips for keeping up with the media, including Google Alerts and following news outlets and organizations on social media. We also include different information about pitching to the media, including information on letters to the editor, op-eds, and press releases. And I'll give a little bit of that information now. Letters to the editor are responses to published articles. Responses to related topics are a great time to plug our cause. Look for related articles and share about how the Good Samaritan law saves lives. Discuss opiate overdose and other related details. You'll want to keep it concise. Many newspapers have strict guidelines around letters to the editor length and won't publish them if they don't fit that criteria. It's important to know that this is not an op-ed, this is a response. With op-eds, these are longer opinion pieces that we write ourselves. When you're writing one, you'll want to learn which outlets are drug user and sex worker friendly, and you'll want to send more op-eds their way. When the news story breaks about overdose, this is the time to write an op-ed. You'll want to jump on it, because if the nation is paying more attention, like they are right now with the opioid epidemic being at an all-time high, we can get better feedback. So send the article to the outlet that broke it, local outlets, and other national news sources. And then with op-eds, limit the article to about 750 words. With press releases, you'll want to write a headline that encapsulates what it is you're doing. A press release is succinct. The first sentence reiterates the headline and adds any details that were left out. The main idea should be clear in the headline and the first sentence. You'll want to include the 5 W's, being who, what, when, where, and why, without any extra fluff. No more than 5 paragraphs. And then you'll want to make sure it's flawless and ready to print. Newspapers receive 1 million press releases, so to have a chance of receiving coverage, yours must take the minimal amount of time to review. You'll want to send press releases when time sensitive, otherwise letter or email is fine. We also include tips about talking to the press. Tips for contacting the press, how to prepare for interacting with the media, and following up after an interview, including you'll want to send out a professional letter or email with credentials and topics you would like to cover, and then prepare an outline of the main points you want to cover in advance. 3 is a good number. Try to include all 3 talking points throughout the interview and keep coming back to them. One other good way to prepare is to listen to a couple of earlier shows beforehand to get an idea of atmosphere and the host style. And it's okay to show your personality at these things. In fact, it's actually preferable. And you can use humor when appropriate. A good strategy is to pretend this is a job interview for a job you really want. And ultimately, you want people to remember you and like you and listen to you. And then afterwards, always send a thank you email with a reminder of how press can contact you if they have any further questions. One of the ultimate goals of your coalition is to be able to pass a Good Samaritan law or to expand a Good Samaritan law to include a carve-out for solicitation-related charges. For this toolkit, we worked and we graciously worked with an attorney from the Drug Policy Alliance's Oakland office, Lindsay LaSalle, who was able to provide example language for your bill. But it's also important to know that these codes, solicitation codes, are really specific to the place that you're in and your jurisdiction. So you'll want to know what codes specifically you want exempt from the law. law, being that people would be arrested, or that basically you want it covered, or you want to have immunity for, what codes those are. And Lindsay included her contact information in the toolkit. So if you would like help drafting the bill language, Lindsay is there for you, and we very much appreciate her. This is the legislative timeline. And our toolkit includes tips for effective state-level advocacy. Some things to know when preparing to advocate include the length of your state's legislative session, things that might be specific to your state when introducing a bill, like if bills can be carried over from one session to the next, and what titles apply to legislatures in your state, because this can range from delegate to assembly person to representative, and you will want to properly refer to a legislature. Things to do when preparing for legislative visits are arm yourself with facts, as many statistics as you can, as many facts as you can, as much research as humanly possible. Legislators and their staff have limited time, so plan for a meeting that lasts 15 to 20 minutes max, and don't be offended if you meet with a staffer rather than the legislator themselves. In fact, this is often the case, but staff do a lot of the legwork, and they can also have a lot of influence. And then create a list of talking points and decide your goal for the meeting ahead of time. And once you have your talking points down, you'll want to practice and then practice again. It can be challenging to keep your message concise and on point, especially when telling personal stories or talking about something you're passionate about. If you're attending meetings as a group, have a prep meeting with everyone to ensure everyone is on the same page regarding talking points and goals. And I do want to say again that our toolkit includes templates for writing your legislator to request a meeting and let them know about the issue at hand. Once your coalition is formed, there are many different things that your coalition can do together to provide even broader protections for people in the sex trade who use drugs or drug users who trade sex. And our toolkit really talks about a couple of them, and I wanted to highlight two of those today. The first is 911 immunity for victims of violence. The first law of this kind just passed in Alaska. And what this does is similar to 911 overdose immunity laws, in that it grants immunity to people who use drugs and people who sell sex who are victimized, so that they can report the violence and then be able to seek medical attention. Because as it stands, if people are engaging in illegal activity and are victimized, they are at risk of being arrested and prosecuted, even though they've just experienced a lot of violence. And then maybe at best they're laughed at or not taken seriously. And so this law allows people to seek medical attention without fear of repercussion, and to be able to keep their community safe, because we know that serial killers who target sex workers do so because of their illegal status, and because they perceive them as like indispensable. And so this kind of a law makes it so that cops can do their job and actually go after violent criminals instead of nonviolent crimes. And this law is really important to have in place, as well as this other law on the right hand, or advocacy strategy to engage in on the right hand side, which is eliminating barriers to accessing rape victim compensation. Rape victim compensation is really important because it can include different things such as rape kits and victim services and medical care, counseling, and trial advocacy. There's a lot of different things that a person can be able to access to help them heal after being victimized, if they are able to get rape victim compensation. But in many states, if a person is victimized while engaging in illegal activity, they are barred from accessing rape victim compensation funds. And so, of course, this primarily affects people who use drugs and people in the sex trade, and sends a very clear message that people who use drugs and people in the sex trade who are victimized don't matter as much as quote unquote innocent people who are. And it's really important to be able to take this ban out of victim compensation funding statutes. So I hope that the last 20-25 minutes or so has been able to I guess, ignite your passion enough that you are interested in pursuing an expanded Good Samaritan law in your state that includes a carve out for solicitation charges and for sex workers. And we are really interested in getting people involved, or at least knowing if people are involved. SWOP-USA provides technical assistance related to this project, so please feel free to reach out to swapgoodsam@gmail.com with questions, and also email us at this gmail.com address if Good Samaritan law expansion is underway in your state, even if you don't want any sort of technical assistance, so we can try to track that. And then generally, we're interested to know about local advocacy efforts that provide protections to sex workers who use drugs and drug users who trade sex, even if it's not a Good Samaritan expansion advocacy. And I want to thank the Toolkit authors. This was a collaborative approach and could not have done it without these people. And I know that since we started late, I just ran a minute over. If anyone would like to contact me, this is my contact information. Thank you very much.
Hi there. Thank you again, everyone, for joining us. Do check out our Good Samaritan Toolkit at swop-usa.org/Good Samaritan, one word, or email the address that Magali provided. I don't see any questions, so thank you again for joining us for this really great mini webinar, and Magali, thanks for a really great presentation.